Hi everyone, it's Nurse Cathy. It's 5 on Friday time again. Hope everyone's had a great week. Well, the past few weeks we've been talking about the importance of your annual wellness visit. We've talked about predisposing factors that can predispose you to certain health conditions and diseases. We talked about colorectal screenings. So this week I want to talk to you about the mammogram screening. Guys, I don't want you to think that this segment's just for the gals out there, because you also can get breast cancer. Breast cancer is malignancy in the breast tissue, and unfortunately the only way we can diagnose breast cancer is through a mammogram. Breast cancer is the second leading cause of death among women, next to skin cancer. Mammograms have come a long way. When they first were doing mammograms years ago, they were on the old films. Now they are digitalized, they're computerized, and they have a 2-dimensional and a 3D dimensional. And per the Susan G. Komen Foundation and their literature, they're saying that they really don't know whether there's a better 2D or 3D version, but they say they're both acceptable for screenings. Now, breast exams are recommended for ladies age 40 to mid 75. Now, a lot of ladies say, I don't want to get that done because it hurts. Yeah, it can be a little bit uncomfortable, because what they do is they take the breast and they place it between two glass slides, and then they apply pressure so that they can visualize the tissue within the breast. Within the breast, there are lobes and ducts that they're looking at, and what they're trying to find is some kind of abnormality within there. For those of you that do experience discomfort with your mammograms, some of that is hormonal, and it's related around your monthly cycles. So if you're still having your monthly cycles, try to plan the scheduling of your mammogram around a time that you aren't so uncomfortable, so you won't experience so much discomfort. Now, should your mammogram shows some sort of abnormality, don't be alarmed at this point, because not all abnormal results mean that you have breast cancer. Now, with an abnormal mammogram, probably the next step would be a diagnostic mammogram, possibly an ultrasound of the breast, and then even possibly a biopsy of the breast to determine whether or not you do have breast cancer. But many of these conditions are benign. Some factors that could affect why you've got an abnormal reading could be that you have dense breast tissue, you might be around your menstrual cycle, so there might be some hormonal changes, the quality of the picture, also your weight and size and age can play a factor in an abnormal reading. Now guys, you're not exempt to breast cancer. You also can develop breast cancer, even though you're at very low risk. Only about 1% of the male population does develop breast cancer. But you still need to be aware that that's a possibility that it could happen to you, especially if you have any predisposing factors like a hereditary gene where you've had a previous family member that's had it. Now, the one good thing about gentlemen is that as far as breast cancer goes, your signs appear a little bit more prominent than a female. You will also often notice the dense tissue or a lump or any kind of abnormality to the nipple area before a woman will experience some of those symptoms. Typically, October is our Breast Cancer Awareness Month, but I wanted to encourage you to take the step to be a jump ahead of the game. Once the facilities start into October, they become jam-packed with appointments, so it's hard to get that appointment. Why don't you be proactive, mark it off your list, get that mammogram done today. We all know because of COVID and so many unfortunate circumstances, there are many out there that are either underinsured or have no insurance at all. And you're very fortunate here in the city of Columbus to have the Susan G. Komen Breast Cancer Facility. And within the facility, they have the ability to offer either free or at low cost mammograms to those in need. So why don't you give the gift? You can give the call at 1-877-GO-KOMEN and help someone get a mammogram. That's all from me. Take care, and be sure to watch Ashley on Monday at Beyond the Table.